Hello, everybody, and welcome to this webinar, which is Puerto Rico in time of COVID-19 and examples from the field. My name is Blennies. I'm the Executive Director of Filantropía Puerto Rico, and I'm very happy for you guys to be joining us today. This webinar series that we host in Filantropía Puerto Rico always explores issues related to Puerto Rico, and we bring different people that give us different perspectives and recommendations to address these issues. And these last webinars, of course, have been refocused to attend the coronavirus disease. You might have seen that as of today, and with very limited COVID-19 testing capabilities, Puerto Rico has reported 513 confirmed cases and 21 deaths related to the coronavirus. And the real picture is worrisome because we are a country with a very high index of poverty, inequality, and a very weak health system. And we've gone through a lot since hurricanes and depression and earthquakes in January. So this webinar is very special for us because we are joining forces with Oxfam. As you might know, Oxfam is a global organization working to end the injustice of poverty while helping people build better futures for themselves, hold the powerful accountable, and save lives in disasters. And Oxfam and Filantropía Puerto Rico join forces today to bring you leaders from community groups and nonprofit organizations that will update us on what's happening on the ground and the current needs of society's most vulnerable. We will also hear ideas on how to help these communities develop action plans that meet collective goals. It's going to be a great webinar. It's very great to have all of you here and to have our special guest and invitees here. Let me give you a little bit of how this is going to go. For all our participants, you should see down below a Q&A icon. This is where you can go ahead and send us your questions. Normally we do 40 to 45 minute presentation, and then last 15 minutes is Q&A, but you can go ahead and send your questions through there, either on the Zoom platform, or if you're on Facebook Live, you'll go ahead and send us your questions on the chat, and we will address those as we go on the presentation probably at the end. Para nuestros amigos de Puerto Rico, esta sesión es en inglés porque hay muchas entidades filantrópicas que se conectan desde fuera de Puerto Rico, pero pueden enviar todas sus preguntas y hasta comentarios a través de los chats en español y las iremos contestando. So let's get started. I think if we put the slideshow for the presentation, we are off and set. And our first guest, well, this is a partnership guest. We have Oxfam, and we have two people from Oxfam, Fatema Sumar, Vice President of Global Programs, and Maria Concepcion. I'll give you a little brief of Fatema before I let her start this presentation. Fatema joined Oxfam America in 2018 as Vice President of Global Programs, where she oversees the regional development and humanitarian response programs. Fatema comes to Oxfam with a distinguished career in the U.S. government, leading U.S. efforts to advance sustainable development and economic policy in emerging markets and fragile countries. Most recently, she served as Regional Deputy Vice President for Europe, Asia Pacific, and Latin America at the U.S. Millennium Challenge Corporation, or MCC, where she managed investments focused on international growth and poverty reduction. Prior to MCC, she served as the Deputy Assistant Secretary for South and Central Asia at the U.S. Department of State and a senior professional staff member on the U.S. Senate Foreign Relations Committee. Fatema, we're happy to have you. I'll give you the mic so you can get us started.
Sure. So Blennies, well, what a pleasure to partner today with Philanthropía.
Thank you.
You and your team. And I'm just so delighted to be here with Maria from Oxfam and with Furia, Proyecto Matria y Taller Salud. So thank you all so much for taking the time. You know, this is a really trying time for all of us in the global stage. And I thought what I would do really quickly is scene set. What are we seeing big picture? What does this mean for Puerto Rico? And then turn to Maria to really deep dive the work that we're doing with our partners in Puerto Rico to date. So, just to take a big step back, we're all following the news really closely, coronavirus, COVID-19 on all of our radars, but what are we seeing today? So, at a really high level, we're seeing that we already have more than 1.2 million confirmed cases globally and over 69,000 deaths in 178 countries. So this is something at the scale we've never really seen in the global pandemic before, and it's really the crisis for many of us of our lifetimes. Half of the world's population, so pre-COVID-19, half of the world's population does not have access to basic healthcare, right? And having to pay for healthcare is one of the leading causes of poverty in many, many countries. We know that this hits women the most, right? So women already shoulder the vast burden of unpaid care. And today they're on the front lines of response. So in some cases, 70% of our retail cashiers are women. 70% of our nurses are women. The majority of people staying home and taking care of kids are women. Thinking about your school teachers and your education population and workforce, mostly women. So women are really at the heart of this and paying a huge price already pre-COVID-19 and certainly today. So this emergency that we're facing really is both a global nature, but it really highlights the importance of local response. And that's really the heart, I think, of this webinar today is at a local level, what can all of us do wherever we sit, anywhere in the United States or anywhere in the world, to really reach out and make sure that we can support the efforts here in Puerto Rico. So let me talk just for a moment about what we're doing globally. Oxfam, as you so rightly said, Blennies, we're a global organization working to end the poverty. We're looking to combine our humanitarian response in more than 65 countries, and we're already working with local partners, Ministry of Health, and key UN agencies and governments in order to be able to respond. We've already ramped up hygiene awareness, delivery of soap, hand washing facilities, and clean water. And we're really focusing on something that's so near and dear to my heart, and I know to many of you on the call today, and that's local humanitarian leadership. And that's this basic, simple idea that, guess what? When emergencies strike, those on the ground in local communities, they know best, and it's our job to empower them, to give them voice, to give them the funds so that they can actually respond in ways that resonate with local communities. So let's talk a little bit about Puerto Rico. Here we're seeing a pandemic, frankly, expose the fault lines that already existed of inequality in our society. I had the privilege of being in Puerto Rico last year, visiting after Hurricane Maria and looking at the damage and the response there. I was really struck. Many Americans go to Puerto Rico often as tourists, right? So they see one side of the island. Well, there's a whole other side that's been devastated, not just once, but repeatedly with Hurricane Maria and beyond. Pre-COVID-19, just for us to think about this for a moment, if Puerto Rico were a country, it would be the third most unequal country in the world, right? It's a country place where inequality, the gap between the rich and the poor, has increased the most since 1990. And if it were the 51st state in the United States, it would be twice as poor as Mississippi. And that's pre-COVID-19. So when we talk today about where Puerto Rico is, it's standing at the crossroad of a number of these challenges. Puerto Ricans are so amazing because of their resilience and their resiliency to be able to respond, but they can't do it alone. They have to do it in partnership with all of us. And in their hour of need, we need to be there to really make sure that we can support. So 4 key areas that I'll just put on your radar that we are really focusing on here at Oxfam. And we're really doing this doubling down with our partners, and you're going to hear from some of them today. So the first is we're directly easing suffering of the most vulnerable in Puerto Rico, focusing especially on women. As we said, they're bearing the brunt of this, particularly caretaking, and they're in grave danger now, particularly around domestic violence issues. The second is supporting frontline organizations to protect themselves and members of their own communities to adapt for the response, including both money and technical assistance. The third area is advocating for strong government response in protection, care, resources, and making sure that our partners' voices are actually the ones being amplified. And the fourth is supporting our partners to really articulate a vision for post-COVID. What does Puerto Rico look like after the virus comes and goes? what are the social, economic, and political areas that really needed fixing before and certainly need the urgent attention afterwards, so that we're really rebuilding Puerto Rico in a way that honors every single citizen in Puerto Rico and beyond. So we're here with Oxfam, so thrilled to partner Blennies with you, Filantropía. I'm going to turn to Maria to talk a little bit more about our response in Puerto Rico. And again, muchísimas gracias.
Gracias a ti, Fatima. Great to have you. Let me go ahead and introduce Maria, who's close friend to us here. And we're very happy to be joining again with you, Fatima, very much. So Maria is Oxfam's America's Program Manager in Puerto Rico. She leads a multidisciplinary cross-sectoral team of national staff and is responsible for the development and implementation of Oxfam's program strategy in Puerto Rico, including policy and program design. Maria has over 15 years of experience working in the nonprofit sector and with government organizations in the United States and the Caribbean, focusing on public policy and strategic planning, as well as working with academia. Her previous work has included technical assessment, project design, major gift campaigns, program monitoring and evaluation, and capacity building. So Maria, we're super happy to have you. Take it away. Oh, you're on mute. Let me unmute you. There you go. Still on mute.
A really special thanks to the entire Filantropía staff, and especially your board, for bringing local voices to this important space. As you know, that's always been a key area of ours, to make sure that local voices are represented. And thank you to Fatima and Adi Martinez Roman in particular for really taking our work here in Puerto Rico to a global, national, and then local scale. Lastly, I want to take a moment to just thank the healthcare professionals in Puerto Rico who are working on the front lines of this pandemic. As we discuss this, it's really, with the limited supplies and access to healthcare that we have, we're blessed to have them. One of the first principles of humanitarian response for Oxfam is proximity. To be close to the communities that are impacted and to structure our response based on their needs. As local Oxfam staff, our job is empowering local community leaders and then share, connect, and provide direct influencing access to policymakers and influences. Today, you're going to hear from 3 important local organizations. These groups are raising awareness about the needs of vulnerable communities, the issues affecting women, and the effects of gender-based violence, and the need to counter institutional negligence. You heard from Fatima how COVID has exposed the underlying issues that Oxfam, along with many other rights-based organizations, has been addressing here in Puerto Rico on the island since 2017, when we first were affected by the hurricanes. Working alongside several allies like Filantropía, who has opened and created important spaces like this for local projects to have a voice with international funders. We are committed today to making sure that our programming grows stronger. Currently, with the Observatory for Gender-Based Violence, Kilómetro Cero, and Proyecto Matria, we're strengthening the rights of women and gender minorities to be better prepared to cope with crisis situations. With Ayuda Legal and their network of community-based groups, we're offering accessible legal information on employment issues, curfew regulations, housing, mortgages, and evictions during the COVID-19 crisis. With other community-based organizations like Nuestra Escuela, Furia, and our public health partners at the Puerto Rican Science and Technology Trust, we're making sure that safe spaces are being made available for us to rebuild our lives, continue to allow children to have safe learning spaces, and for communities to have access to critical infrastructure. I want to take it back to Blennies now, who's going to guide us firsthand, take us through the compounding effects of disaster exposure in Puerto Rico. Thanks.
Yes.
Thanks so much.
Thank you, Maria, and thank you, Oxfam. This work is amazing. Thank you so much. And I really just want to get started with our guest speakers here and the organizations that they represent. So we'll start off with Furia. and Ms. Naida Bobonis, who's going to be with us. Naida Bobonis Cabrera is born in San Juan, Puerto Rico, and completed her bachelor's degree in communications and a law degree, both at the University of Puerto Rico, Rio Piedras Campo, Garrido. As a resident of Buena Vista del Rey, born and raised in that community, at 23, she became president of its board, being the youngest president of the leaders group that make up the group of 8 communities nearby of Caño Martín Peña, Comunidad G8. During her law studies, she became involved in the pro bono program, working directly with the immigrant community on the island. Thus, she also became part of the board of directors of the organization Mentes Puertorriqueñas en Acción, which has as its goal the creation of young leaders. As a member of the Movement for Dignity Housing, she has had the opportunity to talk and advocate on social inequalities and access to justice. She currently works with Furia as the public policy advisor. Naida, great to have you. Let me just give a preview. So our 3 guests, Furia, Proyecto Maddie, and Taller Salud, will have a couple of minutes to discuss and talk to us about what has the organization been doing before COVID-19, what are you doing during COVID-19, and what are the challenges faced by the population that you work with and for the organization. You know, what are the biggest challenges during this time? So kind of that. And go ahead, Naida, great to have you.
Awesome, thank you. So I'm Naida Bobonis Cabrera. I'm the Public Policy Coordinator for Furia, which is Fuertes, Unidos y Resilientes con la Abogacía. Thanks for having me. I'm really glad to be able to share we have the information we have gathered regarding this situation. So I'll start by saying that we are a nonprofit organization which was founded last year, and we concentrate mostly on promoting community resilience, this through participatory advocacy. Education also, and direct work with the leaders for low-income communities on the island. So I guess we feel that our success, working with them, rely on the fact that people really feel comfortable and respected as as how we deal with them, and we help them to work on their projects, and we serve as a tool mostly for them to achieve whatever goal they need. So we've been mostly working closely with the PRODEV, which is the movement of leaders for the right of dignified housing. And this is a group of community leaders which are focused on fighting for secure housing. And we have 88 affiliates, and we are working with more than 50 communities around Puerto Rico. So we're really glad of the work we're doing. Since we started, we've been working in several projects which are aligned with our vision and mission. And some of them are regarding specifically with disaster relief, but on a daily basis, what we do is mostly working on community planning, like in a general way. And also we're developing plans. Actually, like right now, we have developed more than 12 plans with different communities around the island. So beside this, which is like what we do usually, we have special projects. The first one was the Community Leaders Summit, which was on March of last year. And this was organized with the collaboration of the government. In that occasion, we had the opportunity to gather more than 400 community leaders from Puerto Rico, and they had the opportunity to actually discuss topics like security, infrastructural, health, and economic development. And they had the opportunity to share solutions for this. One of the theme that was most important from that was the fear of displacement. And I think that's something that every community can relate to. Another thing that we've done was the Women's Summit, which was in December. And in this occasion, we had more than 60 women. We united them, and they shared their experience, discussed their problems. And the most important thing is that they specify solutions for them and from their perspective, which is the most important thing for us. And there's a report coming out about this. We also have been we developed like a relief program to give direct support to the communities affected in the South because of the earthquakes. And in this program, what we did was we visited the communities with psychologists and engineers in order for them to talk to the people and explain and answer any questions that they may have regarding, the situation that they were facing. And right now, we are actually continuing this project like in another way. We have an initiative with the Puerto Rican Law Bar Association, and they are like giving direct legal aid to the people through phone calls. And in those phone calls, they might ask about FEMA, the process, and SBA too. So that's regarding the the earthquake situation. Beside that, we are also been working on legislation and advocacy regarding this, regarding displacement, specifically with the project 1049, the Senate Project 1049, which is very important for us. We've been also advocating work in advocacy regarding the CDBG DR funds, and now we're focusing on the mitigation part, which is very, very important. We're also working to promote the census, which is another project. And finally, we are looking for ways and resources, as for example, identifying a technological platform in which to provide effective communication between the leaders and us, and the leaders and their community. So that's like a brief of what we've been doing. Specifically regarding the coronavirus emergency, we started, the first thing we did was to make a short video in which we explained our leaders the executive order, which was in March 15. And this was where the curfew was, established. Afterwards, we contacted directly our leaders to know how they were dealing with the crisis, because it's, everything is really new to us. So we contacted 63% of them, from among our list, and we made a report of their information that they told us. We asked about their community in general, how the elder adults were doing, the children, access to essential things, including food, how was the homeschooling going, if they knew about cases of coronavirus, of influenza or mycoplasma, access to information, access to internet, to a computer, any measurements that the community have taken, the leaders also, and any other problems that they may have. So thanks to all this information, we were in the position to actually write a letter to Governor Wanda Vázquez, and that, we expressed our concerns, the concerns of the leaders through this letter. So this was sent last Monday, and we have asked also for a meeting with Fortaleza, the Treasury Department, and the Fiscal Board in order to continue this dialogue, because we think that this is the most important thing. We need to deal with these issues like right now, because people is, the situation is gonna get worse. So we have to deal with this now. Okay, so some of the challenges that our people is facing are difficult to access basic hygiene and basic necessity products. Leaders are very, very concerned regarding the protection and health of older adults, of people bedridden, of asthmatics, those receiving dialysis, people with disabilities. Also, families do not have adequate access to food, and they also are running out of money, which is a very, very difficult issue. The lack of adequate access to technology, or ignorance on how to use it, because it's kind of difficult for people that it's not aware how to use it, and that's like our tool right now. How this situation is affecting the students who need access to a computer or need access to internet in order to continue studying, because the only way they can do it is through the programs to the PDFs that the Department of Education has. And if they don't have internet, they don't have access to this. You know, another thing was the lack of support for leaders in the south of Puerto Rico, misinformation and confusion about the situation regarding the, you know, the coronavirus per se, but also about the aid that is supposed to come. They don't know specifically what applies to them, and you know, so forth. And also the fear of displacement, which is always there. So, oh, sorry.
No, go ahead.
Sorry. I'm sorry. I'm finishing. I promise.
Okay.
So finally, we as an organization, even though communications have worked by, you know, normal phone calls, now we have the limitation that we're not being able to properly give people what we're receiving, because we cannot, you know, just go outside and give away the things and the products that we have been receiving. We also have been struggling with the continuance of advocacy work and citizen participation, mostly because, you know, these things are done by platforms like Zoom, and our leaders are not necessarily, you know, aware how to use it, even if they have access to it, because, you know, they don't have internet or they don't have a computer that works properly. So this technological thing is very, very important. And, you know, these situations, it's not like something the organization can foresee. So we're trying to actually keep a balance and figure out how to work the situation with the current, you know, resources we have. So I think that's about it. Later we will talk about what we're proposing as solutions, but, you know, that's a brief. Thank you.
Awesome. Thank you, Naida. That was great. This is definitely new for all of us, and that's why we need to keep the conversation going as well, so we can continue to learn as we go. So now we're going to Amarilis Pagan from Proyecto Matria. Amarilis is a lawyer, a writer, a painter, a lecturer, and a human rights defender. She graduated from the Hispanic Studies and from the Law School of the University of Puerto Rico. She is co-founder of Proyecto Matria, Movimiento Amplio de Mujeres de Puerto Rico, de Comité Amplio para la Búsqueda de Equidad, the Multisectoral Alliance for Community Economic Development, among others. She has been part of working groups for research on the implementation of the domestic violence law, economic development proposals with a gender perspective, defense of the right to fair housing, and actions to advance legislation, public policies, and actions in favor of the equity of women, LGBT communities, and people living in poverty. Amarilis, happy to have you.
Hello, everyone. I am so happy to be here with you and having the opportunity to present Matria and what we are doing now. Well, I would like to start with the COVID-19 statistics in Puerto Rico. As of today, the government has reported 21 deaths, 513 positive cases. They have performed less than 5,000 tests, and they have about 1,000 pending tests. Government admitted this weekend that they have available COVID-19 tests only for about the 12% of the population of Puerto Rico. That in the moment in which the World Health Organization, for example, is saying that it is important to make as much tests as possible to have the information needed to control the virus. Our working model in Matria is organized around a model that we call 360 degrees of human rights. Our analysis of participants' needs, our services, and our advocacy activities are built on that analysis. We recognize the intersections of oppressions, so when working publicly, many times our claims extend to the defense of other populations living in inequality. We, in fact, recognize the inequality as one of the main reasons or causes of domestic violence and gender-based violence. Before the coronavirus, Matria worked with the following programs. We have a transitional and permanent housing program for women and LGBT people who live in gender-based situations. About 80% of our participants also have some kind of functional diversity within their families. Even they themselves may be someone living with a functional diversity. We also have a program for the incubation of micro enterprises for women, LGBT people, and people living in rural communities. We have one special project named Casa Solidaria Matria, that is a disaster recovery project that we began after Hurricane Maria, and that includes reconstruction, organization, and community empowerment, development of community businesses, psychosocial support, and educational projects for children. We have our main office in Caguas, but we also have what we call satellite offices in Mayagüez and San Juan, plus the Casa Solidaria project is in Orocovis. So we have participants in around 15 towns of Puerto Rico. We work with women. We began working with women 15 years ago, but in the road and while acquiring new experiences, we began to work with homeless people, LGBTQ people, and rural communities. We use a gender and human rights perspective, and we handle issues related to gender-based violence, discrimination, and human rights violations. We are also an activist organization because for us, service without activism falls short. So that's why we have alliances with groups and collectives that do human rights advocacy. So what are we doing now with COVID-19? Well, we are currently offering the following services in an active and coordinated way to our participants. We keep our housing program active with about 50 homes throughout Puerto Rico. We maintain the operation of our business incubator with about 30 participants in different towns. We are working workshops, technical assistance and services to advance their business plans. And we are working with another 68 business women who graduated from the incubator and maintain open businesses because we want to help them to apply for the aids that are available at this moment, because we do not want those businesses to fall because of the coronavirus. We also maintain the post-Hurricane Maria recovery work in Casa Solidaria in Orocovis. Orocovis is in the center of the island. And there we have approximately 120 families that benefit from our services that include economic development, home reconstruction, community organization activities, and mental health services. At this moment, we are trying to promote a community garden to harvest food for the community, considering the crisis that we have in Puerto Rico, and we know that that is a crisis throughout the world. We are also coordinating and offering food, health, legal, and access to education services for all of our participants. All of that we are doing from our homes, and in fact, we are working more than we usually work at office. We are working 10 to 12 hours daily. We also created the Mesa Social. I don't know how to translate that, maybe social board is the correct term for that. And in this initiative, we are working hand in hand with more than 15 organizations of services and human rights advocacy to respond to the COVID-19 crisis. At this board, we have participation of professional associations, community organizations, service organizations, civil rights, and people who want to guarantee a human rights response to COVID-19. Last week, we began our work, social table, okay. Last week, we began our work sending a letter to Puerto Rico governor, signed by 40 organizations, and most of them continue working with us. You can see more information of Proyecto Matria and Mesa Social in our Facebook pages. From this social board, we propose the following actions to identify the challenges we face as a country considering vulnerable populations and the state of our human rights, propose executable responses by the government, but also by organized civil society, to monitor the government's response to COVID-19 and generate the necessary public pressure for that response to be adequate and effective, and to coordinate actions of civil society through alliances between organizations, volunteers, and communities. However, we have the following challenges as an organization, and I think, well, we have a lot of challenges, but the ones that worries me the most are the ones about our personnel, because they are exhausted working with all the issues of gender-based violence, poverty, and lack of access to health services that we are finding in the field. Our participants have the following profile. For most of our participants, and most of them are women, have poor access to technology. They lack of means of transportation. Some of them live in rural areas far from supermarkets and pharmacies. They have little family support, lack of a fixed income. They have minors with functional diversity, or they themselves have functional diversity. They have reading and writing skills and low or moderate reading comprehension, and they live situations of discrimination and violence. This prevents them from access to food or online and health services to fully understand the written communications about COVID-19 and to guarantee their own safety and well-being. It also causes deterioration in mental and emotional health conditions of our participants and their families, the possible loss of income and safe ceiling or home, the potential to suffer violence events. What situation we have with Puerto Rico government that made us create the Mesa Social and that are stressing us in Matria? Well, there are no coordinated responses to guarantee access to food programs in schools. They are not following President Trump's guidelines on distributing food through school cafeterias. The Families First Coronavirus Response Act, the government of Puerto Rico is not implementing it. There are no nutritional assistance services through the family department. There are almost 10,000 applications filed online, but the agency acknowledged that it does not have the capacity to process them. We also, when we consider health, the public health services have a similar problem. Families who became unemployed and without health coverage are filing thousands of online applications that cannot be processed either. The total closure orders, the lockout created by the government, has left people who do not have their own car to go shopping for food or medicine without the ability to move. And they have also caused fear in caregivers when it comes to getting out of their homes to take care of family members. We are also seeing illegal arrests that are being made, and people are being jailed, exposing them to the risk of contagion in the police stations in the island. New crimes are being created by the government and penalties made higher. So we are seeing there civil rights violations, and we are pretty worried about that. In the case of gender violence, access to justice system is diminished, which makes women more vulnerable. Something similar occurs with other populations such as immigrants, LGBT people, users of controlled substances. I don't know how to say that in English in the proper way. Old people and people with functional diversity. There are also so many other issues that require immediate attention. I say this because when speaking of the life and safety of our participants, I am speaking of the country, of Puerto Rico. And that profile that I mentioned a while ago of our participants is repeated on and on throughout the island, considering that we have poverty rates of about 50%. Gender-based violence increased in the last weeks also, and that is important to see. I assume that Tanya can talk a little bit about that because she also works in the same field of Matria. And the government response to gender-based violence has been zero. They have made no special orders, or they have made no special campaigns to address the issue. So the organizations are overloaded with work. For example, in Matria, the number of calls to the organization to ask for services increased, and we are not a crisis hotline, okay? So imagine how is it with other organizations around the island. The demand for services increased without the government doing anything to work with that. So I think that those are my 10 minutes. I think, Blennies?
Yes, thank you, Amarilis. Thank you. That was great. I'll go ahead and remind everybody to send their questions through the Q&A icon on the bottom of your screen. We'll get those going. And if you are in Facebook, you can go ahead and send that through the chat as well. So we have Taller Salud now, and we have Tania. Tania Rosario is an artist, educator, healthcare professional, and advocate for women's and children's rights. Born and raised in Puerto Rico, she holds a bachelor's degree in humanities with a double concentration in drama and history, and a master's degree in public health from the University of Puerto Rico. With over 15 years of experience in the nonprofit sector, she has a solid track record integrating project management, cultural management, community work, popular education, and human rights activism. She is currently leading the work of the historic feminist organization Taller Salud, focused on reducing health inequalities, achieving gender equality, and preventing violence in communities living with greater social exclusion. Her goal is to build a Puerto Rico where there is health, peace, and development for all. Great to have you, Tania. Thank you.
Thank you, Blennies.
Awesome.
Thank you for having me, and I'm sorry. I'm still trying to understand the...
Don't worry, we're all learning about technical lessons as we go.
Zoom. Okay, can you hear me?
Yes, we can hear you.
Okay. So, Taller Salud is one of the oldest Puerto Rican feminist grassroots organization. It was created in the 70s and last year turned 40 years. The term Taller Salud is translated roughly as health workshop, and it literally means that we're working centered on health in a permanent way. So our workshop is always opened, and it also has been broadening the meaning of the word health for us over the years. So I think at the beginning it was very centered around health and human rights, the intersection between health and human rights, women's health in general, and sexual and reproductive health in particular. And that responded to a very specific context for women, which was the 70s and the 80s. And the meaning of the word health has been broadening ever since. So for us, right now, health also means the right to live free from violence, and health also means economic independence. So those are the values around which all our work revolves. Before COVID, we were doing work anchored on 3 pillars. We're working with women, specifically on the issues of violence and access to healthcare. We're working with youth, specifically with a strategy, public health strategy to reduce community violence and to enhance the rights of youth, especially of Black youth. So we're working with racial equality strategy. And the third pillar was communities. We were working to improve community economic development, and that was the result of the relief and recovery work after Hurricane Maria, which was a very intensive 2-year work plan that evolved into a long-term recovery strategy that has been unfolding the process of co-designing and co-thinking and co-imagining what is the development that we would like to see, how does that look like, how is it called, and who is it for. So the process has been multi-level and I'm trying to translate while I speak, but it would be something like multi-factor, in which we've been teaching and learning, and people has been teaching and learning. All our participants, all our community leaders from all the cohorts and all the youth of all our programs. So this past years, especially after Hurricane Maria, have teach us all a very deep lesson about inequality, how disasters do not affect people equally, how disasters are political, and what we have are the consequences of underinvesting on safety networks, underinvesting on the communities to be able to thrive on their own, so that they are ready when disasters strike. So this conversation starts with very specific services that we provide. It can start at the gender violence support group. It can start at the youth leadership cohort group. The conversation can start with the community leaders in the Just Recovery campaign, or it can start at smaller spaces like the psychosocial support services that we provide, which are most services. So at any of those points, the conversation starts, and it always revolves around equality, justice, and power. So what is the kind of life that I want for myself? What is the kind of relationships that I want to build? What is the kind of community that I want to be a part of? And what is the kind of country that I deserve? So those conversations have a different set of dimensions in our work. One dimension is at the level of direct service, which is the level in which people, women, youth, and community leaders mostly come to our center and receive education or support, or a combination of those, or an invitation to a group. And then the conversation starts there. The second dimension would be the community level. When we move these conversations into collective spaces in which you can have participants, members, Taller Salud staff, and community at large. Taller Salud has its headquarters in Loíza, which is a town located on the northeastern coast of Puerto Rico, about 20 miles east of San Juan, and it has a service region. So in Loíza, we receive people from the 7 towns of that coast, starting with San Juan, all the way up to the offshore island municipality of Vieques. So And the third dimension would be the dimension of the island. How do you want to project? How do you want to collaborate? How do you want to co-design with mirror communities? So what Amarilis was just saying about the profile is absolutely true. When you move from different regions, you're going to see the same profile because we have decades of accumulated disadvantages in communities. So you're going to see that the profile repeats itself, and it's a profile that communicates inequality. And that's what we want to tackle and eradicate, because inequality is the main ingredient in community violence and social exclusion, and it has consequences that should be prevented. So once COVID was a reality in Puerto Rico, an admitted reality from our government, and when the quarantine and the I don't know how to translate toque de queda, curfew, and the curfew was established, we had to move some of our services to the remote modalities. So we established a hotline for gender violence, and as my colleagues were saying, we are not a hotline crisis center, and the calls doubled in a couple of days, exceeding our capacity to help. So we started working coalition with other organizations and creating communications materials and socializing other hotlines that were available in other regions, and how you could access help, not only for gender violence, because people were calling because they were hungry, they were calling for other reasons. That was not only gender violence. We started the hotline. We started services, individual case management and psychological services online, both by phone or by video call. So we started exploring also how big the digital gap was within our participants. So we discovered it was not only an issue, it was a combined issue. It was, there's literacy issues that have to do with knowing how to use these platforms. There are also bandwidth issues. So people have limited data or not data at all. So people don't have enough data to download new programs or new apps. So because that would fill the memory of the cell phone they have. So they don't have a laptop, or if have one, they don't have to use it all to the capacity. So it's a combination. We are working on a project to try to establish several hotspots with free Wi-Fi at different points in our community to help a little bit with the gap that has to do with bandwidth and capacity to read emails, fill online applications, and join Zoom meetings, participate in workshops through different platforms. So what we've done is explore the needs and explore the resources that the community had available, and we've been moving and adding services week by week. Once we learn what is the most common thing that people are using, or that is the easiest to implement, or that weighs less. I don't know if that's correct, but we talk about the weight of the apps. So it's an app is too heavy, then we have to consider an app that doesn't take that much memory. The other things have to do with advocacy. How do you consolidate claims that not only speak for our community, but speak to Puerto Rico at large? That's been done in the meantime. Most of the most of the claims have to do with transparency and having the proper information to make decisions, which is maybe the synthesis of our work. You need to have information to make decisions, and you're the expert in your life. So we defend autonomy, autonomy of the individual and also of the communities.
Awesome. Is that it, Tanya?
I don't know if I have more time. Do I have more time?
We're actually, I have a question for all of you, and we're gonna open it up to Q&A. But for all of you three, I'd like to know, how are local and federal policies affecting the work that you do? And what policies would you like to see happen? You know, what policies would you like to see that become part of this new in the future? And that goes for all of you three. So, you know, what local and federal policies help you or affect the work that you do, and what policies would you like to request?
In terms of local policies, I think that the policies in place lack social protection lens and a human rights lens. And I think that is very dangerous. So what we are seeing week after week is having serious issues accessing healthcare services, food, support, and protection from violence. So I think that is the reason. Maybe Amarilis can talk a little bit more about that, for the social task force claims and the alignment table that Amarilis is leading, who is offering the framework that the strategy that the government chose is lacking. It's like they have a giant blind spot. So that's how I see it. I don't know if my colleagues coincide.
Yes, Naida, Amarilis.
Should I or Amarili?
Go
Okay.
ahead.
Okay. So as you know, Puerto Rico was the very first jurisdiction to have the lockdown. So we've been like that since March 15. So in general, what we found is that people are being affected mostly by the local policies, not necessarily by the federal ones, regarding how they decided to manage the coronavirus, crisis. So, like, for example, and as she said, people are not being able to access food properly because children are not, getting food from school. So families who usually were covered by the 2 meals at school, now, they have to provide 3 meals, and they're not, that's more money. And now they have, people are also losing their jobs, and they don't have enough money to make ends meet. There's a lot of people in our community that depends on public transport, and now that isn't working at all. So it's more difficult to people to go on their own, maybe they ask a neighbor or something if the neighbor may help out, but it's not necessarily, that doesn't work necessarily in every case. And that doesn't mean that they're gonna actually be able to go to the supermarket and buy the things, or have access, or have even the money to do that. So another thing that we have is that there's a lot of elder adults which are completely alone. They don't have family support, and that doesn't help the situation overall. So what we are asking the government, like, there are 4 main things. The first one, it's the need of the government to make a distribution plan for the federal aid that guarantees that vulnerable people, which is usually people exempt from filing taxes, or vulnerable people in general, to receive the money directly. This can be done even through the Treasury Department, through the Housing Department, through Family Department, or maybe by doing, you know, a special registry or something. That would be the first one. So the second one, it's fundamental to ensure that every family has proper food at their table. And so we are recommending that the recovery fund for the government to put recovery funds, and this be assigned in order to activate the school's food system and also to coordinate food delivery through it. This could be done with local and community restaurants too. So this will be like, you know, they can inject money in you know, funds into the local small restaurants, and this will help them and will also serve directly to the community. Another thing that we consider important is that people is still scared about displacement, and I cannot stress this enough. So we are asking for the continuance of participatory processes regarding the CDBG-DR funds. And, you know, we obviously will have to consider our current situation and look for ways to do it. Like, for example, we should guarantee the access to internet and access to electronic media with a proper training in order to do this. Finally, the creation of the social task, as my colleague was saying, this will give the government direct advice on how to address the social problems that we're experiencing, because this is all new to us and they've been, you know, multiplying. So we think that the medical task force is not enough, and you know, there's a need of a social one with the representation of the community leaders. That's very, very important in order to address this as a whole and, you know, get the things done right.
Yes, thank you, Naida. Marilis, do you have any comments from Mesa
Yes,
Social
I would like
and others?
to mention a few things about public policies from the federal government that impacts Puerto Rico. For example, the food stamp program that we have in Puerto Rico is with federal funds. And part of the problem and part of the situation that is stopping the family department to work with the petitions of help of I'm sorry, I forgot the word.
No worries, this is our nature.
Part of the problem that we have with the processing of the petitions of the people online for the benefit of food stamps is because the federal regulations have a lot of requirements that the Family Department of Puerto Rico have not managed yet. They were not prepared to offer the service online because of those regulations. Also, when we look at the housing problem, one of the organizations that work with housing in Puerto Rico, the Coalición of Coaliciones, is asking HUD and other agencies to change the requirement to enter the programs, because at this moment we have available beds in some of the organizations for homeless people, but they do not meet the requirements of the federal funds that pay for those beds and houses. And another thing that is making us work harder is, for example, in Maddie we have about $500,000 for our program of housing, permanent housing, and we have money there that we could be giving to our participants, sending them checks or money transfers, but the federal regulations does not let us to do that. We must pay someone else for the food of the participants or the transportation or other things that they need. And that makes us do additional work to guarantee that they have food at their table, because we have to buy the food and then transport the food to their homes. And we have, as I said earlier, we have participants in 15 towns throughout the island. So those are part of the situations that we are living that have to be with federal public policies. And also in Puerto Rico, there is a public policy not named directly by the government, but is that one of the hard hand with the people. Instead of evaluating why people is getting out of their homes while in the quarantine, they are punishing them without questions and without considering their human rights or their vulnerabilities or their lack of food or health services, for example. So there is a public policy of an untold public policy of the government in which they are concentrating all their efforts in security and health services without considering the other services that people usually need to be safe and okay in situations like this. That's why we created the Mesa Social, to make that analysis, and also to pressure the government to do the right thing, and in the things that the government does not respond adequately, then the Mesa Social will work with other organizations to address the issues unattended by the government.
Perfect, perfect. So I have a couple of questions that have been coming in the Q&A. Let me see, let me start from the beginning. So there's a question from Robert Quintero, and I'm sure you ladies are seeing. I think he's asking if you have any alliances with local government agencies and if you work with Manejo de Emergencias to distribute goods received. And he works with Puerto Rico District Exchange Clubs and is interested in working together since of the similarities of the programs done in the 13 clubs of the island. So I think the question would be, do you work with any of the organizations to distribute these goods with any of the agencies?
Manejo de Emergencias, emergency management, they do not have the capacity to distribute the food. Even the Department of Education have issues to do that. We are, from the Mesa Social, we are asking the government to open the Commodores, the kitchens in the schools, and to cook the food and distribute it. But we know that they have issues. What they did was to give the food that they have at the Commodores to private non-profit organizations, but they are not making any evaluation to those organizations. So everyone that says that is a non-profit organization that will distribute the food, they go and get whatever they have in the Commodore. I know that because I asked for the food and know the process, and I made a lot of questions because I was surprised how they were giving the food that they should be using to feed our children and their families in the communities where the schools are. So that is the only thing that the government has done. But this week, the Fiscal Oversight Board sent a letter to the governor saying to her that they are not satisfied with that, and they are not in compliance with the federal rule about the use of schools to give food to the children. So we are waiting to see what happened with that. And today we are going to write to the Secretary of Education in that same line, asking him to open the Commodores in the schools.
Perfect, thank you. I have a couple of questions and comments. So I'm wondering how people who were displaced from the earthquakes are doing now with the shelter in place ordered. Where can they quarantine? And how Oxfam, Pier, and its partners like Furia are helping them from afar. This is Maddie. Hi, Madison. Thanks for your question.
Blennies, if it's okay, I can respond to that. Thanks,
Please.
Madison. So happy to have you here. Join Glennies and myself and the rest of the team here. Madison, as early as 2 days ago, and we're going to go ahead and forward you those news reports. People living in outside of their homes in informal shelters, continue to live in that situation. And you're right. I mean, these are communities that are at grave risk. Our partners continue to work with them As you know, we've had to make some adjustments to our direct service in the next coming months. All of us here in this panel have had to make adjustments to our work plan, but within those adjustments are addressing these vulnerable communities. And so some of these individuals that are living outside in their own tent communities are going to continue to do that. And again, we have to find ways to get to them and provide the much needed psychosocial support that requires, because again, we're still carrying the burden of the earthquakes, the hurricanes, the earthquake, and now COVID. And no community is going to be left unattended. And I will pass it over to Taller Salud, that has also had to make adjustments in their community, Furia and Proyecto Matria. We've all had to make adjustments in our direct service. Yeah. I don't know if you guys want to add.
Say quickly, so regarding the South, as I said before, people are saying that they are not receiving the aid. Obviously, we had the program in which we went there, physically and gave them the, psychological support and the engineers. But right now, that's not a possibility. And the reality is that a lot of people is, through the calls, we knew that people is getting inside in their houses, which are not livable at all. They should not be going inside, but they're more scared about what is happening outside with the coronavirus, that, the house is gonna follow me. So I guess that something that we're doing right now is the legal aid. So we have been in continuing communication with them. I personally, have called them and asked about legal issues regarding, telling them that this service is going to be done. But we're also trying to identify organizations that are more in the South, so we can, put them in contact and maybe through an alliance there, give them what they need. So, we're struggling, but we're trying regarding our circumstances, to keep in touch and try to help.
I think if I can just add quickly, I think it's important also to mention Naida and the strong program service delivery that we're seeing with the Puerto Rico, with the Response Innovation Lab and the Puerto Rico Science and Technology Trust. I mean, again, since Hurricane Maria, all of us have worked together to develop networks to ensure a continuum of care, a pathway to care for these vulnerable communities. And so now, we'll address it. We'll address it, whether it's through telemedicine, whether it's through more calls, whether it's through platforms such as Zoom, or as you heard from Tanya and Amarilis, we still continue to have technological challenges. Even the NGOs ourselves, including myself, our bandwidth sometimes is not enough. We have a precarious service from our carriers down here. So, but again, we are going to manage all this, because this is the moment. This is the moment to reach out to our most vulnerable population.
Yeah, and we are learning and becoming as we go within this new reality that we're creating, like Tanya was mentioning, because we are definitely aware that we are changing globally. So this is our opportunity within all of our organizations to be part of that creative way forward. Couple of questions, comments. Ana Navarro, I recommend a future conversation in Spanish. This is another inequality issue in our country. Yes, thank you, gracias. Definitivamente estaríamos más fluidas en español todas nosotras, pero we also want to bring these issues to other people that have leverage and can also connect us in different ways, and this is why we also do it in English, just to bring those opportunities into perspective. And we have a couple of things here. Let me say, Carlos, I wonder how do the jails, specifically women's jails in Puerto Rico, is mitigating the COVID-19 pandemic? is Taller Salud or any of you ladies have any program in place or any conversations going on about the penal system in Puerto Rico? Good question.
For incarcerated women, but we do have a member of our board directs an education program, and she's been providing us with details about conditions, needs, and ways in which Taller Salud can collaborate. So we are moving forward a conversation to help out inside Puerto Rican jails.
Mm-hmm.
Cool, thank you. So I do have a couple of people that have made their comments, like from Lorena Legal Aid Clinic, that would like to help, and a couple of other people that are saying, hey, we know you're getting many, many calls, so how can we as a ciudadana be able to help in these projects and even assist in these calls? So we will be sharing all the contacts after this call, and you'll be able to reach out to these organizations if you are interested in volunteering. I think that would be great. Two people mentioned there is getting crisis calls. Well, there's kind of one comment from Katia, and this is for Tania and Amarilis. I think you guys are seeing the questions. She works with agriculture, so it's a region that has very little capacity for internet, and after Maria, the footprint is very bad, and most of them do not have smartphones. How are you attending this population, if you are? Any comments on that? And I'll take that as a last question and we'll close it up.
In the case of Matria, we are visiting the community. There is part of the staff that is visiting Miraflores, because definitely not everyone there has even a phone, okay? So there are limitations, and with the community council, we have meetings through conference call. Sometimes they are pretty chaotic because they do not know how to silence their phones and so on. So sometimes we are about 12 people in the same call, and you may imagine how it goes. But we are working with them, and we are lucky because we developed leadership there in the community before this crisis, and they are collaborating, the community council is collaborating with the work of Matria there. So sometimes we communicate, we call some of them, and they do things, they call the other people. In fact, the last week, there were about 5 or 6 people of the community council that made a survey in the community to detect coronavirus symptoms, because we are working with another group that is named Brigada Salubrista, that is making those studies in the island. So we are working from distance, but we are also going to the community, taking all the measures necessary not to contaminate them, you know.
Please. Yes. One last question, and maybe Naida, this is for you. How do you think COVID-19 pandemic is going to affect relocation and repopulation processes in Puerto Rico? Any of you three have any comments?
So on the top of my head, so I think, like, for now, the main problem is the participatory processes, because we were in communication with the Department of Housing, local Department of Housing, and we were, going somewhere. But the thing is that right now, there's the possibility of communicating with the leaders is very, the capacity is, small, because of what I said, that they don't necessarily have knowledge on how to use platforms like this. So that's why, I think we are struggling with that, but we're also looking for resources regarding internet and technology in order to solve this, like for now, but for the future too. And I guess the main problem is that we need to continue continue this communication, because the people is still in fear, and we need to hear them. We need to be sure that the leaders are heard somehow. And I know it might be hard in this situation right now, but that's not something we can, give up. So they need to be called for the making of decisions, and they need to be there in order to be heard.
Absolutely. They need to be present and show up. And
yeah.
Awesome. Thank you. Thank you, everybody. Thank all our panelists. Oxfam, thank you so much for joining forces on this. And I also want to open it up for last comments from Maria and Fatema. But let's reflect upon this work and how we can continue to support these local nonprofit organizations. It is important that we recognize the existing power that is within our communities and our local leaders, and from that space to really continue to share, connect, and provide these organizations with, funding and policymakers and influences and contact for all of that, so they can continue doing this work. Maria, Fatema, do you want to have any last comments before we go? We're past our time.
Yeah, I would just say, on behalf of Oxfam, and just to say first, it's so inspirational to be on a panel with other amazing women like this. So just huge shout out to all of you and the incredible work you're each doing. And, we started the conversation talking about women and gender and talking about the unique needs that women in particular and girls face in this crisis. And it's just really inspirational. We started talking about the importance of local leaders. Maria talked a lot about how much that drives our mission. To put power at the hands of local communities so that they can make their own decisions about their health and their resiliency and their well-being. And so just the examples that you gave today in this webinar alone about how you're already doing that, how you're going to continue to be doing that, and that we're in this together. I mean, the scale of what we're seeing is going to stretch all of us as a society, as a community. And so the more we can do today to be prepared, to do good planning, and to not really, to not underestimate the scale of the challenge that we have together. This is stretching all of us at a local, national, and global ways like we've never seen before. So this moment is so important to really work together and to really band together and understand the unique needs of Puerto Rico and how we can support our local partners on the ground to be the face of the response and to empower them with what they need. And so Blennies, I'm really appreciative to you and Filantropía for pulling us all together and putting these voices, these incredible voices, at the center of the conversation. To people like Maria as well. So I'll turn to Maria. Thank you so much for having me on.
Definitely. We will continue to do that. That is definitely our purpose. Maria, did you want to say anything?
No, again, I just, for those of you who may not know this, I've seen your work grow over the last 15 years. And so again, another disaster, and this is a moment where Filantropía has to be present, has to be part of that local humanitarian leader. When Oxfam talks about local humanitarian leaders, we're including Filantropía as well. And what you've done to really bring the issue of Puerto Rico to philanthropists in the Caribbean and in the States is really monumental, because for a long time they weren't looking at us here in the Caribbean. So again, thank you for allowing us to have this space today and to continue to work in strengthening the groups here that we have today. And there's more. If you let us do this again, we'll fill it up.
Absolutely, absolutely. If anything we're learning is that we have to do this together. Yeah. So we will continue to do this together. We've passed our time. Thank you so much, everybody. Thank you, Oxfam, Tania, Amarili, Naida, everybody. You've been wonderful. We sent a link for a feedback. Please fill that out just to see how we're doing. Even besides our English or Spanish or technical difficulties, we want to be sure that we are doing things correctly, that you get to tell us what other things you'd like to hear from these webinars and any other organizations. We will be sharing all the contacts of everybody, because I know in the questions and comments you said that you'd like to help, and even Amarilis, I hope you saw a comment there from Taylor. And you will get the recording for this, and you can go to filantropiapuertorico.online for past webinars and the recording of this webinar. But we will send you through email all the information so you can get that to watch. And again, thank you so much for watching. Thank you, ladies. It's great to be here with you.